Hello everybody, this is Namita Thapar, Executive Director of MQ Pharmaceuticals, and today we're going to cover a very unique topic, SMA, that stands for Spinal Muscular Atrophy.
So it's a little heartbreaking diagnosis for us also.
This is like cancer, The more I learned about the disease, the more our world crumbled.
They would usually die by 1 year or 2 years.
The only money you get from the government is 50 lakhs for the lifetime.
They may start sitting, but the problems don't stop.
Because there's one time gene therapy is 14 crores, and then this is the kind of expenditure that people are dealing with in our country. Is there insurance for this?
At one point, parents asked, why me? Why my child? After a certain time, the child also asked, why me?
And to talk about this, we have two ladies today. Dr. Neelu Desai, a pediatric neurologist, who will give us the science and the symptoms, the causes, and help us understand this condition. And then we have Alpana, a wonderful mother who has dealt with this. Her son Aarav is 13 years old. She'll talk about her journey, and most importantly, she is the co-founder of the foundation and support group called Cure SMA that is helping parents across India get more aware and work with the government, pharmaceutical company, and doctors to bring about advocacy and change in this condition. So without further delay, let's talk to our two lovely ladies and understand this better. Dr. Neelu, why don't we start with you? What is SMA?
So SMA or spinal muscular atrophy, it's a genetic disorder which affects predominantly children. And the problem here lies that there is one important nerve cells, anterior horn cells, which have an important protein, and that protein is lacking because of a genetic defect. And this lack of protein makes the nerves weak, and slowly it affects not only the limb muscles but also the respiration, the sometimes heart, and then slowly the overall weakness ensues, and they may sometimes become bedridden, sometimes go into respiratory failure. And so this is what, in short, the disorder is about.
And is this something that they are born with, doctor?
Yes, usually they are born with because it's a genetic disorder.
Correct.
So they have it right at birth.
Correct.
But the presentation may be different.
Okay.
Some may present right at birth, some in the first few months, others may be in the first few years, and there is very few who present even in adulthood.
And what are typically the causes? I know you said it's genetic.
Yes.
But are there any causes other than it just being
a
genetic reason out of nowhere?
It's purely a genetic disorder.
Okay.
And it is a recessive gene. So both parents have to be carriers for the child to have this disorder.
Can it be detected ahead of time? So pre-pregnancy, can a gene screening of the parents detect that there's a higher probability of the child getting this?
Yes, of course it can be detected, and we are doing it routinely. So if a child has been diagnosed with SMA, for further pregnancies, future pregnancies, we offer them genetic counseling, and we detect it antenatally, and many times we have been able to detect the same disorder in the other children, and we have advised them whether they want to terminate the pregnancy.
Okay, understood. And what are the symptoms again? So you said it can manifest at different points in
Yes.
their life. But what are, and I know you said there's breathing, there's mobility issues, but can we just go a little deeper into what the typical symptoms are that a parent should be aware of?
So it depends on when the child presents. So in newborn period, it may come with severe breathing difficulties or feeding difficulties. In little older children, maybe few months old, it may come with, delayed in achieving of motor milestones, like delayed head holding, delayed sitting, delayed walking. And in little bigger children, it may come with walking difficulties where they are not able to run properly, difficulty climbing stairs sometimes, or frequent falls, and slowly the milestones may go behind. So if child who is walking may slowly stop walking, a child who is sitting may slowly stop sitting.
But being a mother of two children myself, your first go-to person is a pediatrician.
Yeah.
Right? I mean, you wouldn't go to a pediatric neurologist first. You just go to your general pediatrician.
Yeah.
Are the pediatricians in India well aware about this to then send it to a specialist like you for further diagnosis?
Yes. This is not that uncommon also.
Okay.
So most pediatricians would be aware of this disorder. In case they are not, they would definitely seek help of a pediatric neurologist, knowing they may not be able to diagnose SMA and first go, but they may know that there is some nerve or muscle problem and whom to refer to.
And then when they come to a specialist like you, other than, of course, taking the history and knowing the basic case study and typical symptoms, are there any other tests that you would do to ensure that it's a correct diagnosis?
So when it is very obvious, we would straight go ahead with a genetic test.
Okay.
So there is a genetic test results are available in a week's time, where we can confirm that this is SMA. In case of doubt, we may first do a nerve conduction study, a nerve testing, and we demonstrate there is some problem in the nerves, and then we go ahead with the genetic testing. So final confirmation both ways is by a genetic diagnosis.
And this is obviously an extremely traumatic experience for the parents, right? Because you don't suspect it, you're not prepared for it, and then suddenly you realize that it's a rare disease that your child has. So how do you counsel the parents, and how do you explain to them the treatment options? Because the saddest thing is when it happens to little babies, and this is something that in most cases you detect in little babies. So how do you counsel parents, and how do you explain the treatment options to them?
Yeah, so it's a little heartbreaking diagnosis for us also, and to give it to the parents. So a few years back, there were no treatment options. So finally, in a child who was early onset, the ones which presented in first few months, they would usually die by 1 year or 2 years. Right. So we had to slowly inform the parents about this. But with the advent of newer therapies and a lot of research going on in this field, there are now options available where we can give them a ray of hope. Of course, they are extremely expensive treatment options, but at least there is some hope. Also, there are more and more neuro-rehabilitation services, there are multidisciplinary care clinics which are available. So where these children can be monitored closely for any signs of impending respiratory problem or severe scoliosis or the other problems which these children have. And there are certain specialized clinics which are there now for this disorder, which we are able to holistically see these children.
Correct. So, just coming back to the treatment options, how many years back was a gene therapy, which is a one-time injection? I mean, how many years back did this really come about? It's pretty recent, right?
Yes. So it was in 2019 that the single-dose gene therapy
So we're talking about only like 5.5 years back.
Yeah. Prior to that, there was another gene therapy which had come, which was in 2016, which was a little different way. It was, so there are two genes. I'm just telling you a brief about the genetic makeup. There are two genes which are responsible for making this protein. Right. The main one is SMN1, which is which these children, they don't have it, because of which there is no SMN protein formed. But there is a second gene which makes 10% of the protein, which is called SMN2. So there are three treatment options. One, which replaces the SMN1, which is one-time injection, corrects the defect, the body starts producing the SMN protein, and slowly the child shows improvement. But it depends a lot at which stage have you given the patient.
Correct.
If you have given it right at birth or very early in life, they may turn out absolutely normal because your motor neurons have been intact. But if you give it little few months down the line or even later, a lot of motor neurons have already died. So the results may not be optimum, but yes, they would become stable at that stage and they would not further deteriorate. This is what SMN1 does.
Correct.
The other two treatments target on the second gene, which is SMN2, which is an alternate gene which also produces little amount of SMN protein. So it's not definitely changing your genetic scenario, but it's definitely benefiting these children.
And if I remember correctly, the first treatment, which is treating SMN1 gene, that is once in a lifetime gene therapy, one injection that costs 14 crores. And the other two treatments, the patient would have to take throughout their life. So it's a, for your lifetime treatment. And that is the one that is treating SMN2. And it's something that you would have to take forever.
So that targets on SMN2 gene. That is, one dose is less expensive, but if you consider a lifetime of doses, it turns out even more expensive.
But again, it's relative, right? Because there's one-time gene therapy is 14 crores. And even when you talk about less expensive, you're talking about 70 lakhs per year for your lifetime. So eventually it ends up being 10, 12 crores over the lifetime anyway. And then this is the kind of expenditure that people are dealing with in our country. Is there insurance for this?
No, there's
no insurance at all. And also we spoke about one other really big gap, which is in other developed countries like US, there's newborn screening that is mandatory. So you find out the minute the child is born, whereas in India, this concept of newborn screening is still being debated. Can you just talk about it a bit more?
So as I said, here the time is like motor neurons. Each second is important because your motor neurons are degenerating. the earlier you start the treatment, the results will be the best. If you detect this disorder right at birth, and if you institute therapy at that point of time, the results will be like any normal child.
Right.
The later you give, the results will be less optimal.
Right.
So here is one condition. If you detect it right in newborn, it will be very effective. But the thing is, it's not available in India. In many other parts of the world, it is available. But yes, in India, it's not yet there, newborn screening.
So I think this is one thing for
Yeah,
any
which we
government
can-
official who is
yes.
listening,
Yeah.
in addition to funding
Yes.
and insurance, if
Yeah.
newborn screening is something that can be worked on. And then the other very important area, before we come to you, Alpana, real quick, is one last thing that I want to cover from a technical standpoint is a multidisciplinary approach.
Yes.
Right? So you said there's obviously a physiotherapist, there are breathing issues, there's a spine surgeon,
Yes.
there are other comorbidities, and you said there are clinics, specialized clinics that
Yeah.
deal with this. But can you give some indication of what are the multiple things that the child would need in terms of support post giving the gene therapy?
Yes, so just gene therapy giving one injection is not at all enough because you need to monitor these children for many years more because they have other problems also. So they have scoliosis, they may have hip dislocations.
What is scoliosis?
Scoliosis is where your spine curves.
Correct.
And it curves and it deforms your posture and then it impairs with your breathing.
Correct.
So your lungs get deformed, it indirectly affects your breathing, and then you develop more pneumonias, and then you may get sometimes respiratory failure also because of that.
Right.
So that is scoliosis. They may get dislocation of hips
Right.
because of hypotonia, contractures. Then they may have fractures.
Right.
They may develop feeding dysfunction. So, they may have swallowing problems because of which nutritionally they may be becoming very poor. They have frequent infections which don't get cured easily because the breathing muscles are also weak. So all those problems are there besides mobility issues, besides, these are mentally normal children. So they can see that they are having these problems.
Absolutely.
They see that other children, their ages are running, playing, but they are bedbound. So it is quite traumatic, especially because you are mentally absolutely okay.
Right. No, absolutely. And, we had a very interesting chat before the podcast and we were talking about autism. And you mentioned that in some cases, autism may be harder to treat than SMA because SMA, at least the child is mentally very alert.
Yeah.
And now over to you, Alpana. Firstly, thank you so much for joining us. I know you rescheduled a lot of things for being with us today. And most importantly, not just are you a parent, but you are such a strong advocate by being a co-founder of Cure SMA, a foundation that is creating so much awareness. So Alpana, I'd like you to talk about this in two ways. One is your journey as a mother. So it's personal and we understand what you did and how you dealt with the entire knowledge, awareness, and then now supporting your child the best you can. And then secondly, what you want society, government, all of us to take out of this in terms of awareness and advocacy. So one, as a mother, and second, as a co-founder of the foundation.
So thanks a lot, Namita, for having me. And I'm Alpana Sharma, as you said, co-founder for Cure SMA Foundation of India. I'm also mother of 13-year-old SMA type 2 boy, Aarav. So he has SMA type 2. What happens that, the initial, and I'm talking about 12, 13 years back when there was no treatment, no awareness. There was, till initial few months, things were normal. He could sit and other milestones were met. But around 10 months, there was something amiss. So he could not even walk or stand with support. Crawling ability he started losing, and I would say luckily I come from family of doctors, so I would little better placed it than many other parents, I would say, in the similar journey. And it was my brother-in-law who suggested us to get some vitamin or calcium test done. He's a pediatrician. So my sister, I remember very clearly jokingly said that you get to see patients entire day. So maybe you are just thinking that, he has some milestone delay. But Aarav's first birthday came and went. And rather than, standing or trying to even cruise through furniture, the milestones that he had, he was not able to even meet those. So then we started meeting with pediatric neurologist as suggested by our pediatrician. And I would say, today the scenario is a lot different in terms of awareness. Again, 12, 13 years back, it was a very bad scenario. Everyone told me, just go love your son. There's nothing much you can do because there was no treatment, no hope. My brother lives in California, so he was the one actually who kind of, arranged for me to attend. There's a international organization called Cure SMA US. So he kind of made all the arrangements for me to attend that conference. And I would say, attending that conference was eye-opener because post Aarav diagnosis, it was one of the darkest phase of our life. There was no family history in our case, and we got all the tests. My sister being a gynecologist, we got all the precautionary tests done. But I remember, my pillow would be drenched with tears. Why me? Why my child? The more I learned about the disease, the more our world crumbled. But as I said, I attended the annual conference for by Cure SMA US, and a lot of research were happening there. The research that today we are talking about, mucinous, and then actually the gene therapy, which was actually started by Casper brothers, who were the original scientists for this. We met all of them, and more than that, we met SMA children, adults who were living a very fulfilling life. So as you both were talking about that SMA doesn't affect the cognitive ability. Somewhere it's a boon and somewhere it's a bane as well. Right. Because at one point parents asked, why me? Why my child? After a certain time the child also asked, why me? Yeah. Why it has to be? So we learned a lot of positivity from there because we need to focus more on abilities rather than disabilities. Those children or adults were lawyer, engineers, CEOs doing so well in their life. Yeah, even we have today, I'll talk later about our foundation. We have SMA adults who are one of them is working with Microsoft, one is working with Google. They're IITians, MBA from Columbia University. They're into filmmaking as well. So coming back to this, once I came back to India, I kind of started looking for a similar SMA organization, but there were none because 10 years back, no awareness for rare disease. So we started with actually a Facebook group, and I was fortunate to have met, I would say today, my soul sisters. We are 5 mothers, basically from 5 different locations in the country who are running this organization. And we also get to meet, compassionate doctors. Dr. Neelu Desai is actually my son's pediatric neurologist as well. So we need a lot of support system. And in these kind of condition, what happens? That stigma is also attached somewhere, and especially because it's a genetic condition, you're not spared, because the society will keep saying that either it has come because of your bad karma or use the mother's side more than father. It is labeled at times to the mother's side. So in this world where everyone is standing against, even a handful of people supporting you can help in long way. So from that 5 to 10 families, today we are more than 1,500 plus, and
so it's a community that's there for each other.
Yes, we have formed, and with support from a lot of compassionate people, as I mentioned, Through Cure SMA Foundation of India, what we have done is we have tried to bring a platform where both the parents, patients, caregivers, as well as our external stakeholders, the government, the pharmaceuticals, the HCPs, healthcare professionals, the insurance people, the society in general can come together on a platform, and then we can try and create a better world, along with a better infrastructure, a better world for these children and adults with SMA.
Tell us a little bit about Aarav. How's he like? What's his journey been like?
So he's extremely naughty, and I get almost every week I get a call from the school that he has done this or that. But he is an extrovert, happy-go-lucky child. This year itself, he has won 2 international Olympiad medals,
lovely.
One for
Fantastic.
cycle, one
Congrats.
Thank you, and one at Maharashtra level, the NTSC state level. Yeah. So somewhere the academic performance, we are trying to teach him to focus more on his abilities. He's into coding and blogging rather than, because now that he's entering teen, he has all these questions. And as I said, society is not accepting. We still have birthday parties where he doesn't get invited because of the fact that, he's in wheelchair, the venue might not be accessible, and the games that they need to play needs to be more made accessible. But we do have good friends who will try and include him in everything. So it's kind of...
He's become more resilient, hopefully, because of
Yes,
that.
it's it's him and these children who give us hope, because ultimately this disease is a progressive condition. And see, as a parent or as a child, as Dr. Neelu was also saying that when we are handed about a diagnosis with no cure, now there is a treatment, and as a Cure SMA India, we have been instrumental in getting those treatment to India as well, and we are working with a lot of pharma companies, the regulatory authorities, the government of India for this, but there is still, the access is not there for these children. So it gets very difficult for them at different stages.
In fact, here we should bring about this point of the rare disease policy in our country, because I studied that policy and we were discussing how the only, money you get from the government is 50 lakhs for the lifetime of the child, which is a drop in the ocean. So even the policy, there's not much funding. And then we also discussed there are only 13 centers of excellence where the bureaucratic process and all makes it very hard for even getting that 50 lakhs. So let me come to this point straight away, the advocacy point. If you had 3 asks of the society, government, pharma companies, what would those top 3 priorities be?
So first of all, I'll just talk a little bit about the national policy for rare disease. Sure. We have already filed a case. We had won in a landmark judgment by Delhi High Court. We won where Justice Pratibha said to allocate 900 plus crore for the treatable rare diseases. See, SMA is one of the disease which is treatable. My ask, as you said, from all these stakeholders is that at least for treatable rare disease, let's have, if government is not doing, there is public-private partnership. There are CSR through which we can do treatment, again, is one aspect of it. These children or adults need support throughout the life. Right. There's a BiPAP, there's cuff assist, there's rehabilitation or physiotherapy that is required, spine surgery, that itself is so expensive. So let's say the treatment is very expensive, at least support us, in all these things to make and navigate life easier.
And I believe at this point, for the injection that costs 14 crores, I mean, how is anyone to afford it? It's mostly crowdfunding,
and
right?
And that's where, even when they go for crowdfunding, it gets so difficult because every time you are asking someone else to put hands in their pocket and give money. So somewhere people are making such derogatory remarks like online begging and all these things. And it's not feasible. The sustainable solution cannot be. Few cases have been successful, but as we talk, it is 1,500 plus parents, patients. So it is not possible for all of them to do the crowdfunding. And that's where the public-private partnership, the corporate social responsibility can come and help us a lot. And as a parent, it's very difficult to see my child slowly dying away in front. This is like cancer, it's slowly eating them away. And because they're cognitively very bright and sharp, they can be asset to our government. I remember having a meeting in the CDSCO, the Central Drug Association, and we told them that these children, they can be asset to the nation. Right to life is fundamental. Everyone should have right. But problem is, changing things in India takes a lot of time. And here time is motor neuron, as Dr. Neelu was also
I think
saying.
This is, Alpana, I'd really like to compliment you again. Thank you so much for sharing your journey. And Dr. Neelu, we've come to the end of the episode because we've spoken about the science, we've spoken about the advocacy. Any parting words that you would like to say to people watching this and trying to get aware about this condition?
I would first like to appreciate the Herculean efforts which this SMA support group is doing. This is really, it drives us, the clinicians also, to find out new ways how to help these children. Yeah. And I think more and more awareness about this disorder, and if government can help, if pharmaceutical companies can help, I think there may be better treatment options. And I think most of the patients may have some access to treatment.
Absolutely. Thank you so much. So this brings us to the end of another real heartwarming episode. It's difficult to see, like Alpana said, children suffering, children slowly dying in front of your eyes, so many challenges, so much pain, and you feel helpless as a parent, you feel helpless as a clinician. And I think this is one condition where, of course, we need to start with awareness, but there is so much that needs to be done from a funding, insurance, policy, government, pharmaceutical, clinician. It's a village that has to come together to give hope, to give a lot of optimism to these children who, like Alpana so beautifully said, can be true assets to not just our country but to the world out there. So I hope today's episode brings about that positive change and is a small step in the right direction. Thank you so much. Right?
Yes,
Oh
great.
God.
Thank you.
Every episode gives me goosebumps.